Welcome back to the Delaware Way. Dealing with mental health issues has become a priority across the country and here in Delaware. Helping to lead the effort is the Mental Health Association. Jennifer Seo is the Deputy Director. Thank you so much for being here. It is true that mental health has come to the forefront across the country.
It has, and I think there's been a lot of bad publicity regarding it that's brought it to the forefront, but I think there's also been some good things about mental health that have come to the forefront that, I think people are taking a notice now and people are advocating for it. They're talking about it in a less stigmatized way, and so I think we're really making some headway when it comes to mental health these days.
One of the times when the mental health issue comes to the forefront, especially in news coverage, is when there's a police interaction with someone that's mentally ill, and sometimes that doesn't go well. Oftentimes it's because the police aren't properly trained on how to deal with someone who is mentally ill. What does your association do in regards to that?
Yeah, so we do a lot of education and training regarding mental health and suicide prevention specifically as well. And so especially with the Wilmington Police Department, we have trainings for their recruits, and they have a recruit academy about once every 2 years or so, and we're invited to do two types of trainings with them. One is an 8-hour mental health first aid training, and another one is a 2-day suicide intervention skills training called Assist. Also, there's something called crisis intervention training for police officers, and I believe that's about a full week's training, about 40 hours or so. And NAMI Delaware, which is an organization similar to ours, they do the trainings for police officers throughout the state of Delaware. So I am happy to say that we are doing a lot more with our law enforcement and really equipping them with the skills that they need to deal with mental health crises. We've
had the chiefs of many of the departments in here, and one of the things they talk about all the time is dealing with mentally ill people that they get called to either intervene in suicide or because they're acting out in some way. As a matter of fact, the chief of the Newcastle County Police was saying at one point, if my radio was here, it would be going off constantly, and 1 out of every 3 calls is about someone with a mental health issue. I would think that you'd want to teach more than just the people in the police in Wilmington. Would you hope that other police departments would get involved?
Right. And I think at this point it's a voluntary thing, and so there's no mandate requiring law enforcement to get any type of mental health training. So our agency specifically works with the Wilmington Police Department, and then if we get requests from other law enforcement agencies, we'll work with them. But I know with NAMI Delaware, they kind of focus on law enforcement at large throughout the state, and so we are targeting kind of Newcastle, Kent, and Sussex counties as well. But there's definitely more to do for sure, and I think we can equip our law enforcement officers with the skills that they need to respond to these situations in a very empathetic and sympathetic way, while also making sure that they feel safe and protected, right, while dealing with these crisis situations.
Well, that's just as important. No, I get it, but I assume you'd accept a call from the Newcastle County Police Chief if they want to call.
And give us a call
and have you help out. Suicide prevention, as you mentioned, is a big part of this.
Yes.
And suicide, unlike mental health, people don't talk about it.
Yeah.
and even when I've been a news anchor for a long time, and when there is a suicide, we were told, don't say what the cause of death was. Don't call it a suicide, whether it's a police officer or a veteran, or especially with teenagers. Do you think that's a good strategy to not talk about it?
So I think there's discretion with how you go about talking with suicide, but not talking about it doesn't help. And I think also because we live in an age where technology is so readily available, there's social media, people find out about these things regardless of if we keep our mouths shut or not. And so I think there's a proper way to communicate when a suicide does occur. We don't want to glamorize it or make it seem like, we don't want to memorialize anyone that's died by suicide, but we do want to talk that someone has died by suicide. We don't have to talk about go into graphic details of how they died by suicide, but we definitely want to address it. And during that time, I feel like, we can also address postvention, which is a way of helping those who are left behind after someone dies by suicide deal with that struggle and deal with, the loss that they've experienced. And by doing postvention, we're actually working on prevention too. Because one of the risk factors of suicide is actually having experienced a loss of a loved one. And so it kind of puts you at a greater risk. And so if we do postvention work in a good way, we're able to prevent further suicides from happening.
I was always told you don't want to publicize it because there could be copycats or it could inspire someone else to commit suicide. Is that Is that real?
So there's definitely copycats, and there's something called suicide contagion. And actually, back in 2012, there was a suicide cluster in Delaware, specifically in Kent and Sussex counties, of youth ages like 10 to 24. And we lost about 12 to 14 youth that year. And that was the highest that we've had in terms of the suicide of youth for any given year. And so the CDC actually came in and they deemed it as a suicide cluster. But we did a lot of prevention work. And you do have to talk about suicide, because a lot of these youth and the community at large, they experience the loss of their community member. And so by not talking about it, you're actually doing a disservice. And by talking about it, you also allow for other people who may be experiencing similar feelings or feeling vulnerable, or maybe they're struggling with thoughts of suicide themselves, to come out in the open and to talk about it as well.
I would think you're hoping the people that either are struggling with mental health problems or are the family of someone with mental health problems to contact you. And you're there to help.
Right. We have an information and referral line. We're open Monday through Friday, 8 to 4. And so anyone can call that number if they're looking for a practitioner, or maybe they're looking for services, or they don't know where to start when it comes to navigating the mental health system, because it is quite confusing. Give us a call. We're happy to help if we can.
Wonderful. Thank you so much for coming in.
You're welcome.
I appreciate
Thank
it.
you.
Jennifer Seo is the Deputy Director of the Mental Health Association. The Delaware Way continues right after this.